Cancer treatment is no longer limited to chemotherapy. Medicine has evolved significantly, and so have your options. Hi, I'm Dr. Neema Bhat, Senior Consultant Hematologist, Transplant Physician, and Pediatric Oncologist at Therrapie Multispeciality Clinic. Today, I'll walk you through 7 advanced cancer treatments that are already available in India. And at the end, I'll share 3 essential questions every patient should ask their oncologist because informed decisions save lives. For decades, cancer treatment meant 3 things: surgery, chemotherapy, and radiation. These remain important, but what has changed is that we now have entirely new categories of treatment that work differently and in many cases more effectively. These are not experimental or future treatments. They are being used in hospitals right now, including here in India. Let me walk you through 7 of them. Number 1 is immunotherapy. This, in my view, is one of the most significant advances in cancer treatment in our lifetime. Here is how it works. Cancer cells can hide from your immune system by sending signals that say, "Do not attack me." Immunotherapy removes that disguise. It allows your immune system to recognize the cancer and fight it. The results have been remarkable. In advanced melanoma, one of the most aggressive cancers, the 10-year survival rate has improved from less than 10% to over 40% with immunotherapy. That is a transformation. Immunotherapy is now approved and available for more than 20 different cancer types, including lung, kidney, bladder, head and neck cancers, and several blood cancers. And it is available here in India. Number 2, targeted therapy. Traditional chemotherapy attacks all rapidly dividing cells, both cancer and healthy, which is why it causes side effects like hair loss and nausea. Targeted therapy is different. It identifies a specific genetic change inside the cancer cell and attacks only that. One of the best examples is a blood cancer called CML, or chronic myeloid leukemia. Before targeted therapy, most patients with CML lived only up to 3 to 5 years and required a complicated procedure called bone marrow transplantation. Today, with a daily tablet, with just 1 tablet a day, over 83% of patients are alive at 10 years or more. That is the power of precision treatment. Similar targeted drugs now exist for breast cancer, lung cancer, and many other types. The key is molecular testing, identifying the exact mutation so the right drug can be matched to the right patient. Now, number 3, and this is one that I find truly remarkable, which is CAR T-cell therapy. Your own immune cells, which are T cells, which are present in all of us, are taken from your blood, sent to the lab, and genetically engineered to recognize your specific cancer. They are then multiplied into millions and infused back into your body. These modified cells then seek out and destroy the cancer. This treatment has shown remarkable results for blood cancers, including leukemia and lymphoma, particularly in patients where other treatments had stopped working or have failed. Clinical trials have shown response rates of 70% or higher in patients who have had no other options remaining. What is especially encouraging is now India has its own indigenous or domestically manufactured CAR T at a fraction of the international cost. These treatments are more accessible than it was even 2 years ago. If you have a family member which has a blood cancer and has relapsed or is considered refractory, this is one of the important options you should definitely discuss with your hematologist or hemato-oncologist. Number 4, bone marrow transplant. This is not a new treatment, but the advances in how we do it have become extraordinary. The biggest challenge with transplant was always finding a matched donor. In the past, you needed a fully matched sibling or an unrelated donor from a registry, and many patients simply did not have one. Today, we can perform half-matched transplants using a parent, a child, or a sibling as a donor. This means nearly every patient now has a potential donor. The outcomes with half-matched donors are now approaching those of fully matched transplants. India alone has over 100 transplant centers performing these procedures, and the numbers are growing every year. Number 5, minimally invasive and robotic surgery. In the past, cancer surgery often meant large incisions, significant blood loss, and weeks of recovery. Today, many cancer surgeries can be performed through small incisions using advanced camera systems and robotic instruments. The result? Less pain, less blood loss, shorter hospital stays, and faster return to normal life. For cancers of the prostate, kidney, colon, and several gynecological cancers, this is how the standard approach at many centers works. Number 6, precision medicine. Every cancer has a unique genetic profile. Through advanced genomic testing, we can now map the specific mutations that is driving your cancer. This allows you to select the treatment most likely to work for you rather than using a one-size-fits-all approach. Studies have shown that patients who receive treatment matched to their specific mutation have a significantly higher response rate in some cases almost 5 times higher compared to those on unmatched treatment. I would recommend discussing genomic testing with your oncologist, particularly if you have an advanced or difficult to treat cancer. And finally, number 7, combination therapy. Rather than using one treatment alone, we now combine treatments from different categories: immunotherapy combined with chemotherapy, targeted therapy combined with chemotherapy or immunotherapy. Each approach attacks the cancer through a different pathway, a different mechanism, making it much harder for the cancer to resist treatment and also to come back. What should you ask your doctor? Now, if you're a family member who's been diagnosed with cancer, I want to leave you with 3 questions to ask your oncologist. 1. Is genomic or molecular testing indicated or recommended for my particular cancer type? 2. Am I a candidate for immunotherapy or targeted therapy? 3. Are there any clinical trials available that I should consider, specifically because my cancer is resistant to most standard therapies? These are important conversations to have, and your doctor will appreciate that you are informed, and these questions can genuinely open doors to options you may not have known about otherwise. If you or a family member is dealing with cancer, we are here to help. You can book a consultation at Therrapie Multispeciality Clinic. The link is in the description. And if this video was helpful to you, please subscribe and share it with your near and dear ones and someone who may benefit. Thank you.